Good afternoon, I'm Anthony Lugg with the Midday News. A special welcome if you're watching on OneSpotMedia.com. 6 additional people have been hospitalized with COVID-19, increasing the number to 251. Of that figure, 19 are critically ill. This is 2 fewer than yesterday's figures, while 49 are moderately ill, an increase of 5. In the meantime, there was another record number of COVID-19 cases in the island on Monday. That as 468 people tested positive for the virus. This is the highest daily record for the virus. It's also the second time the country has surpassed 400 cases in a single day. The first being last week, Tuesday, when the country recorded 403 cases of the respiratory illness. With these new cases, the country's COVID tally is now 19,773. Their ages range from 3 months to 89 years. The number of active cases also increased to 6,513. No deaths were recorded yesterday. However, 2 deaths are under investigation. Scientists have identified another new variant of coronavirus in the UK with some potentially troubling mutations. The new variant appears similar to the South African variant, which prompted door-to-door tests in areas where it has been found. Researchers from Edinburgh University have found 33 cases so far in samples dating back to December. It has been seen in other countries too, including Denmark, Nigeria, and the US. UK experts are studying it to understand what risk it poses. St. Mary's saw the highest number of COVID-19 cases of any parish in January. With 96 confirmed cases, over 400 recoveries, and over 50 active cases, Medical Officer of Health for the parish, Dr. Tamara Henry, says getting vaccinated is now more urgent.
During the monthly sitting of the St. Mary Municipal Corporation on Thursday, Medical Officer of Health for the parish, Dr. Tamara Henry, disclosed plans to roll out vaccinations in 3 phases.
It is to commence in February, this month. And who are the persons who are to benefit? Frontline workers that include our fire personnel, police, healthcare workers, and our soldiers. Not just them, but also our elderly population that we are saying are facing the brunt of the problem with the deaths and the severe illnesses.
Under Phase 2 and 3, the general public will have access to the vaccine. While getting the vaccine is not mandatory, Dr. Henry is appealing to all frontline workers to get vaccinated. For the AstraZeneca vaccine, which Jamaica is getting, 2 doses administered months apart are needed for inoculation.
As you're aware, we are using the AstraZeneca vaccine for this cohort. It is done, there are 2 doses to the vaccine, and it is actually an adenovirus-based vaccine where the DNA is encapsulated in an adenovirus that is inoculated into the deltoid muscle of the adult. Right? So we're not going to use it in children, so only persons 18 and above will be vaccinated.
In addressing concerns about whether or not 2 doses will be needed and how long the immunity will last, she says more information is needed.
Well, at this point, they have indicated that you can get 1 shot, but as I said, information will still need to be shared with us, because remember that when you're infected, you're not going to, the immunity, we're not so sure how long it will last. So in the initial phases, you can get 1 shot, but even after that 6 months, the recommendation is that you can get your 2 shots, not the 1 shot.
Dr. Henry also sought to quell fears about the vaccine.
We are asking the general public to remember, as our council has indicated, that we have a long and lasting history of vaccinating our people and keeping them safe. We have not lost them. So it's not a time now to become afraid and run away. No, we have a time we have to stand together in this, because we are losing persons, and this doesn't have to happen.
Cody-Ann Barrett, TVJ News.
The growing number of confirmed COVID-19 cases has pushed the healthcare system to the limit, and the men and women on the battlefield against this pandemic are near breaking point. The issue was raised with the presidents of the Jamaica Medical Doctors Association and the Medical Association of Jamaica on the morning agenda on Power 106 today. O'Shane Masters reports.
Healthcare workers on the front line of the coronavirus pandemic are struggling to deal with the increasing caseload. This as a result of a growing number of workers contracting the virus. President of the Jamaica Medical Doctors Association, JMDA, Dr. Mindy Fitzhenley, says the physical and mental health of these workers are under threat.
That essentially means that you would have to be working non-stop to be able to make any sort of money. And then if you have children or if you are, have a relationship, any sort of other commitment, it's impossible for you to work like that. Nor is it healthy for you to be slaving and working 7 days a week.
Dr. Fitzhenley says healthcare providers are stretched thin across duties and in most cases without adequate time to refresh themselves.
Right. So when we work straight throughout the day continuously. If you're able to squeeze something into your mouth, then great. I can't ever recall a time in the last 4 to 5 years that I have stopped and had a legitimate lunch break. It's just not something feasible when the patients keep coming in.
Now, there are more stories detailing a shortage of medical equipment, placing workers at greater risk. It's the reason President of the Medical Association of Jamaica, MAJ, Dr. Andrew Manning, is calling on the government to address the situation.
Depending on the interaction, that may mean a surgical mask, it may mean a proper field-tested N95 mask, it may mean a face shield and so on. And that actually is a challenge that we're having now. There are limited supplies of these things. So it's not just that the doctors are tired and stretched. Some of our colleagues on the front line put themselves to real risk.
Shane Masters, TVJ News.
And it's time for a break, so stay with us. More stories when we return. Welcome back. Continuing the news. The RJR Gleaner Communications Group, of which this station is a part, is now working closely with the Ministry of Health to assess the impact and what additional steps it needs to take after 2 of its employees had positive COVID-19 results yesterday afternoon. This added to another positive test, which was recorded last Friday. There have been further evaluation and testing of members of one department this morning, from which 2 cases were identified. The group has had strict COVID procedures implemented for several months, including a working from home arrangement for a substantial number of its more than 1,100 workers. The group has also scaled back some of its programming, production, and marketing activities as a further precaution. The National Secondary Students' Council has joined the conversation about whether the government should suspend face-to-face classes. The recent spike in COVID-19 cases has prompted calls for the Education Ministry to halt face-to-face classes. However, Public Relations Officer at the Council, Rihanna Robinson, thinks otherwise.
In the last 3 days, Jamaica recorded a total of 943 new cases of the coronavirus that threatens to worsen the public health care crisis. State hospitals have been bursting at the seams because of increased hospitalization resulting from the virus. Some of those cases have disrupted classes at several schools. The most recent incident is at the Happy Grove High School in Eastern Portland, where a member of staff tested positive for COVID-19, prompting the institution to suspend face-to-face classes. In the face of the mounting COVID-19 cases, the Jamaica Teachers Association, JTA, made several calls for in-person classes to be discontinued. JTA President Jasford Gabriel explains that while various protocols have been put in place to limit the spread of the virus at schools, what happens outside the institution is worrying.
What is creating the serious concern here is the gatherings of students. When they leave school, when they are coming in, the transportation issue. I heard Minister Mackenzie last week saying we have in excess of 500 illegal parties each week. And I have seen for myself, I happen to know that especially our high school students, they are engaged in these. And so if it is we were able to contain the students within a kind of bubble at school, then the concerns would be less. The fact of the matter is, if every day they go out and they come in and they mingle and they are asymptomatic.
Despite the cause and the growing numbers of COVID-19 cases, Education Minister Fayval Williams has pushed back against the pro-lockdown movement. And the National Secondary Students Council, which represents high school students, is also against the suspension of face-to-face classes. Public Relations Officer at the Council, Rihanna Robinson, says the move would not be in the best interest of students.
The spike in cases is extremely alarming. However, we have to take into account the learning loss as well. And a complete dismissal of all face-to-face classes is not the best solution if you're thinking of the best interest of the students. If you really have the students first, then you would not suggest to completely close schools, because that will not benefit the students. They're going to suffer. There are so many students who are not connecting any at all. We have to pay attention to the rural areas. We have to focus on our exam students. We have to make sure that they're in the classroom. And whilst it is that this concern is extremely alarming, this spike is alarming, we have to find another way.
She argues that all students will not be able to get online soon enough to fill the gap should face-to-face classes end. She's suggesting schools be evaluated on a case-by-case basis.
They have to look at it. How many of our students really aren't connecting online? If it is that, say, just for example, there are 30 students who aren't connecting, you can have online classes because you must be able to find resources for 30 students if you're talking about a school of 1,700 odd, right? So we think that you need to go back to the drawing board and assess the schools that are open and see really and truly if they need to be open. But if it is that they can close, then they ought to close.
As of February 5, more than 400 schools have been approved to restart face-to-face classes, but only 240 have resumed. Sandy Williams, TVJ News.
Justices of the peace are being warned to be on the lookout for deportees who are increasingly engaging in fraudulent transactions. JPs who conduct business for the wrongdoers are being warned that they could end up in jail. More in this report from Cody and Barrett.
More than 20 new justices of the peace are now serving Clarendon. They were presented with their instruments of office at a ceremony held in observance of the COVID-19 safety protocols. Custos for Clarendon, William Shaguri, warned the new JPs to be wary of a mushrooming fraudulent practice involving persons deported to Jamaica.
Please, for God's sake, when you depot in the name, it's very, very important you know who you're signing for. A lot of trickery goes on, especially changing passport, deportees and things like that with the depoting. So please be very careful. What I'm telling you, I want you to understand, serious business. Serious business, it can put you in jail.
The Custos also reminded the JPs that their role is voluntary. He said the practice by some JPs to charge for their services is an embarrassment, and their explanation that the money is for envelopes and other stationery is not good enough.
Because there has been too many little complaints about justices charging $500. You know, no. Remember, you are supposed to be looked upon.
The commissioning ceremony was virtually attended by Justice Minister Delwar Chuck. He explained that some of the crime-hit communities in Clarendon needed more role models, and that's where the additional JPs will come in.
In Clarendon, regrettably, we have far too many gangs and criminals who believe that they can dictate what happens in various communities. Together in Jamaica, and certainly together in Clarendon, you must find ways and means to work with the police, work with the ministers fraternal, work with the custos, work with one another to isolate and sideline the criminals.
Cody and Barrett, TVJ News.
Back to some COVID-related news. Despite some sectors in the country returning to some level of normalcy following a measure last year to suppress the COVID-19 outbreak, the manufacturing sector continues to face pressure. President of the Jamaica Manufacturers and Exporters Association, Richard Pandui, says the negative impact on the sector could last until close to the end of this calendar year.
President of the Jamaica Manufacturing and Exporters Association, Richard Pandohi, is predicting that the first 9 months of 2021 will be more challenging than at any point during the pandemic before.
The tourism sector was shut down, and it's even worse now because of the effective travel ban from Canada. We see it's more difficult to travel to the U.S. because of required testing. So that has further decimated the tourism sector. We're seeing now, with spread in Jamaica, we're now seeing workforce issues right across the sector, especially in manufacturing. And in the manufacturing industry, we're seeing a lot more workers now being unavailable. And in general, we believe that the first 9 months is going to be very, very sticky.
With an outbreak among industry workers, he says production will be slowed. But unlike last year, advancements in vaccines are offering some hope.
In fact, the private sector and the government is signing an MOU later on the vaccination plan for Jamaica. The Ministry of Health and Wellness, that is. That will happen later. However, so there is definite hope at the end of the year. Every day you see a new vaccine being authorized. So, we're optimistic that the solution is there.
Despite the challenges during the pandemic, there were also some significant opportunities for the exporting sector.
The chemical subsector also pivoted very nicely. People went into making sanitizer gels, and the bleach people actually started exporting. The paper industry, we had companies in Jamaica exporting tissue to the United States. So although we are exposed and there are many challenges, there are also many opportunities.
It also aided in the revamping of some small businesses to expand the horizon of their services. In addition, he said there were things that the pandemic taught manufacturers.
The tourism sector is gone pretty much, but Jamaica has not collapsed, right? So you have to now look and say, okay, what isn't happening? Where are the other pillars that we should be concentrating on? I think the creative pillar is a huge pillar. The agro-processing, the agricultural pillar, and I'd rather say agro-processing, because you have to think the whole value chain, not just planting the primary product, but what else do we do with it?
In the meantime, Mr. Pandohi is hoping that by the end of the year, Jamaica will be a signatory on the Madrid Protocol. The protocol allows a company to register its brand in multiple countries under one cost. This will ultimately protect brand Jamaica globally.
I was informed 2 weeks ago that the bill has been sent to the Attorney General for the trademark bill for changes, and when that happens, then it sets a process in place, and this year we should be a signatory.
He was speaking on TVJ's Smile Jamaica this morning. Kodian Barrett, TVJ News.
In news overseas, without providing any proof, a Shia militant group is claiming responsibility for the rocket attack in Erbil, Iraq. A civilian contractor was killed and a U.S. soldier was among the injured. More from the CNN.
A total of 14 rockets were fired at U.S. and coalition forces stationed near Erbil International Airport on Monday night, defense officials told CNN. As a result of that rocket attack, one civilian contractor was killed, one U.S. service member was injured, and 5 other civilian contractors were also injured, all but one of whom were American citizens, according to defense officials. In this video, you can see one of the rockets there landing on a busy street in Erbil, a cloud of sparks and smoke flying into the sky after that explosion. The Kurdish and Iraqi governments have said they'll work to find out who was responsible for the attack. Suspicion immediately fell on Iranian-backed militias in the region. It was similar militias that were responsible for an attack on U.S. and coalition forces back in late September. If it is indeed the case, once again, it is the first major test for the Biden administration on its Iran policy, how to find out who's responsible and how to respond to this attack, all as it's trying to figure out what to do with Iran's nuclear program and attempts to enter or renegotiate the nuclear deal.
To news in sports now, the principal of the region's largest sports college has joined sentiments that the facility should be one of those at the forefront of the return of sports in the country despite the ongoing COVID-19 pandemic. Karen Madden reports.
I spoke about the physical distance of the tracks and the fields and the golf places and so on. What it does, it brings about a greater awareness as to where these facilities are. They can remove the sanitization on large plots of land.
That was sports marketer Carol Beckford speaking last Thursday on an RJR Gleaner Group Sports Town Hall on the issue of COVID-19 and the safe return of sports. We put Beckford's recommendation to Maurice Wilson, who is principal of the G.C. Foster College of Physical Education and Sports, located on 44 acres of land in Spanish Town, St. Catherine.
I think that G.C. Foster has a responsibility to provide that template for not only our professional athletes, our persons who want to get fit, persons who are doing sports for recreational purposes, but for our high school athletes and coaches to understand what is supposed to be done during this period of the pandemic.
Wilson also pointed to the critical need for athletes and others to remain physically active.
Well, first of all, we need to acknowledge that the world is participating in sports. The world has come up with a formula, a template for the inclusion of sports people to compete. If you don't compete, you cannot perform well. Professional athletes have a job to do. Similarly to other areas of the society where persons go to work, whether it be at the bank, in factories. And so we must create that environment for these professional athletes.
Sporting bodies have failed to obtain permission to host events, even though the government announced on February 5 that approval would be granted on a case-by-case basis under the Disaster Risk Management Act. Karen Madden, TVJ Sports.
And that's the Midday News. I'm Anthony Lugg. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, good afternoon.